Welcome everybody to Medicare Secondary Payer, working with conditional payments. This webinar is to answer your questions about conditional payments related to MSP claims or Medicare Secondary Payer claims. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today, I'm joined by Leanne from my team, who's going to help with the questions in the chat. She's going to add some links. She's going to try to filter anything going on down there, so she'll make sure we monitor that chat. If you want to make sure you can get something from us, please feel free to put a message into the chat. Just say hi, whatever you want to do, just to make sure you can get back and forth to us. But that's up to you to do that if you'd like to. If not, you can wait until a question arises. Let's do a little housekeeping. If you want the presentation, please go to our website. And on our website, go to our training center and then go to our live events page. You can download the presentation from there. I'm going to show this to you because I was asked exactly where it is. I'll have Leanne put a link to live events also directly in the chat, but just in case someone wants to see it. So it's our website, wpsgha.com. Across the top, stay on the very top and go to the middle. It'll say Training Center. Then on there, you're going to slide down to the word live events, which is going to be in the left side in the body. It's the first box. And then you must just kind of scroll down until you find the one you're looking for. It is the second one on the list today. This will remain available on here with the webinar download, the webinar materials download link until either later today or tomorrow. But that's how you're going to find it. So hopefully that'll help you if you need that. Once we take it off of this page, within a week or so, we should be adding it to the Encore page, which again is in Training Center. Sorry. It's the middle link in the body. Okay, in the top row, it says Encore Presentations, and you'll be able to open it up, watch it, but on the bottom, you'll be able to download the follow-up material, which is the same presentation. Okay, so you can do that if you want. That is our first question answered for the day. So again, you can send questions in the chat. What we will do during the time we have today is answer any questions that were pre-submitted and then work through our chat questions as well, hopefully giving you guys all the answers you need to get through what you want to know about conditional payments for Medicare Secondary Payer. After this event, I will be asking that you take a survey. The survey is a CMS survey, and it just indicates what I did well, what I didn't do well. Was my presentation good? Could I have improved on anything? There's also a question that you get to grade WPS as an overall MAC. So great opportunity for you to give us feedback and also topics you would like to see in the future. So we'll get to that right at the end. Let's go through just some basic disclaimer information. For those of you that attend all of our webinars, this may sound familiar to you. This material is an educational tool. The Medicare rules do change often, so the answers that we give, all of the information given within the presentation, it's just for education. The rules and regulations are all available for you on the CMS website. Later on, I will actually show you some different pages from the CMS website that you'll need. So I want you to be aware of that. Again, the information is accurate as of today. So what's our goal for the day? One, to help you understand the conditional payment concept and then to answer your question. I will tell you that I did have a few people say they were new to Medicare joining us, and so I don't want to leave them behind, which means I do have to start at the beginning giving a definition of what MSP or Medicare Secondary Payer is, and then what conditional payment is. We don't want to leave anyone behind. Then we're going to talk about locating the information. Where is it located on the CMS website, the WPS website, some different resources, things like that. Last, we're going to finish focusing on the questions that you asked pre-submission during the registration process, and then anything you put in the chat. Okay, that's our goals to get through today. So as I said, thanks for those of you that are new and are just joining Medicare and yet you wanted to hear about this, or this concept was a different concept for you. I do want to make sure that I give you the information you need, one, to get through the conditional payment, but also to understand what MSP or Medicare Secondary Payer is. So during this section, it becomes very important that you put questions back into the chat, okay? Let's get through defining some conditional payment stuff. So first, oops, I don't know what happened there. Conditional payment. This is a payment given to a provider When another insurance who is responsible for considering the charges does not make a payment or give you an explanation of why they're not making a payment within a promptly paid period. If you say to me, wait, what's a promptly paid period? We're going to talk about that on the next slide. So hold on to that thought process for a moment. Conditional payments do apply to workers' compensation liability, including self-insured and no-fault insurance, when it is primary to Medicare, which means they have to consider the claim before Medicare can make a payment. Okay. So part of the goal of the conditional payment is to protect the patient. That means that the providers should not bill the patient for this service when they're billing for a conditional payment. It's part of that financial protection that we want to give the patient. So hopefully that makes sense to you. Again, we'll talk more about the conditions in the promptly paid period and other things you need to be aware of in just a little bit. On the bottom of this slide, there is a CFR reference, and that's the Code of Federal Regulations, and it's 42 CFR section 411.52. If you open that up, that particular reference up, it's going to give you a lot more information on the conditional payments, why we do what we do, and how we have to go through the different things. Again, it's the Code of Federal Regulations. I'm not going to select it, but you can go ahead and take a look at it should you need it. One thing that I was asked is if conditional payments apply to all parts of Medicare. Now I'm going to assume that you mean Part A, Part B, Part C, and Part D. That's what I'm assuming. Conditional payment is for fee-for-service Medicare traditional, which is Part A, hospital insurance, and Part B, medical insurance. I do not know if Medicare Advantage or prescription drug plans, Medicare Advantage is Part C, prescription drug plans is Part C. Don't know if they offer that. We don't work with them and we're not allowed to comment on them. So again, please keep that in mind as we go through. This is for traditional Medicare Part A and B. All right. So the first rule that you have to be aware of with conditional payment comes from this promptly paid period. So let's define the promptly paid period. Here's what it says. It is payment or an explanation received within 120 days after the primary receives the claim. So it's 120 days, it's 120 calendar days. It's not a business day requirement. So that was one of the questions we got is it calendar or business? And 120 days is a calendar day requirement. Okay. So the primary insurance received it and 120 days later, you don't have a claim decision. You have the choice to file for a conditional payment. We'll talk more about what that choice means and all the things you have to accept. The promptly paid period is simply a measurement that you must wait under the requirements before billing Medicare. Okay. So what is the promptly paid period and how does it start? For workers' compensation and no fault, without evidence to the contrary, the day we use for Part B is the date of service, or for Part A is the date of discharge. What types would be evidence to the contrary? The fact that you filed it, the fact that you filed a different claim over 120 days ago. But now you're having a second claim, maybe you're doing a follow-up, and it still had the first claim still hasn't been paid or no decision has been made on that. That would be an example of what evidence to the contrary is used. For liability, the promptly paid period, again, without evidence to the contrary, is the date it posted to the common working file. Okay, so again, that's the date the claim posted to the common working file. So a general liability claim is filed, we look for that. A lien is filed against a potential liability settlement, and then the date of discharge or the date of service. So basically really look at the date of service. A lot of people have asked us if they can just simply say, look, we filed it, it's our date of service, and we're going to go 120 days from the date that we filed it to the primary. Can that just be the 120 days we use? Sure, that's perfectly acceptable. Whatever makes it easiest on you to do that, that's how you want to track it. However, CMS does give us certain time frames, so take a look at those if you're interested. I do recommend making it as easy as possible on yourself. So if you say it's easiest for me to say for this claim it's 120 days, or for this claim because it's a follow-up claim it's 120 days from the one that we previously filed. Either one of those is perfectly acceptable. Okay, let's go on. What are our basic conditions for the conditional payment? Well, you must have filed the promptly pay period. Well, that makes sense, right? The 120 days has to pass. You can't just say, hey, give me some money. Medicare doesn't do that. They say, hey, okay, did you file it within the promptly paid period? Has it passed that 120 days? All good. Second, you have to accept assignment. Medicare does not issue conditional payments when you do not accept assignment on the claim. Okay, that's the basics of it. Third, you have to consider not billing the patient for liability as assigned by Medicare. Now, why do we say consider not billing the patient? Because there are times when, let's use a liability claim, for example, or a no-fault claim, for example. The insurance will make a settlement, come back to Medicare and actually pay us back, which doesn't have anything to do with you. You keep the money you were paid, everything is good, and you bill the patient for that. That's why it's not a definitive don't bill the patient. That's why it's consider not billing the patient. So if you do bill the patient and then later do receive money from a different source, whether it's the primary insurance or whatever, you have to refund the patient any amount that you billed and Medicare the original payment if it's due back to Medicare. So if the claim is paid back to you, then you have to work with Medicare to get us back the money that's owed to us. That's why we use the word if a lot here, because if it's a lawsuit or if it's something like that, it may actually be paid back without you being involved at all. The Benefit Coordination and Recovery Center may recover it from the primary insurance. Now, if you're not familiar with the Benefit Coordination and Recovery Center, they're also the ones that add the information to the common working file and update that information. Okay, so they do all the different updates and all the different pieces of information. So those are your basic conditions. One of the questions that we receive frequently and that we did actually get 3 times during this set of pre-submitted questions is, do I have to file for a conditional payment? No, Medicare does not require you to file for a conditional payment. Now, the key thing I said there is Medicare. That's different. Other states or local laws may want that conditional payment. They may require you to. Medicare will consider it. But Medicare does not require you to file. Other insurances may say, hey, if you want us to pay you, I need this Medicare liability, whatever that happens to be. And the liability they're actually looking for is deductible, co-insurance, or copay. What would Medicare have paid? Now, if they don't offer a conditional payment and they're going to say, hey, we're going to wait until the primary insurance makes a decision, which again could be that liability, that no fault, or that workers' compensation, then that's what we're looking at there. Again, you don't have to file to Medicare. It is completely your option. You are not required to file a claim. So one of the questions that we did receive in is that says we were asked by a lawyer to file a claim. They want us to file it. That's fine. They can ask you to file it, but ultimately it's your decision on whether or not to file it. What they're trying to do is to work during that process with Medicare, using the Medicare allowed amounts to refund all of the money back. Different than working with individual providers. It can take them a lot more time and is more time consuming on their end, if that makes sense. So it's not really about the provider and whatever. Medicare does look at it from that perspective though. Do we ever require you to do it? No, Medicare does not. Okay, I'm going to stop there for just a moment. Next, we're going to move into locating information, which is just a basic slide. And what we're going to do is move through some of the common questions and the other things that we've seen when we talk about locating information, which is what we're going to use to answer some of the questions and kind of help you through some of the different pieces of information. Okay, so locating information. So first, everyone's probably familiar with the CMS website. If not, and you're new, because we did have a few of those on there, the CMS website is www.cms.gov. On this website, this is where the official rules and regulations are that we must, as the Medicare Administrative Contractor, or MAC, processing your claims, and you must, as the provider providing the services, follow. So again, this is the website that we go to for all of these basic information, okay? We're only gonna focus on the Medicare section. Why is that? Because CMS, the Center for Medicare and Medicaid Services, does have a lot more out there. So there's a lot of different pieces of information. And so we don't want to have all of that different stuff put together, if that makes sense. In other words, I'm not going to talk about the Medicaid section or the state children's health section or any of that. We're just going to focus on Medicare. As I go through this, these are going to be different options and things. I'm going to show you how to navigate to them live on the website, but what I want you to know is that you can simply click on the links provided within the slide deck and it'll take you directly to those sections. Let's go ahead and use this Medicare Secondary Payer Manual as a sample. And it will open directly to the manual, and then you can scroll down and read all the stuff you want to know. But how do you get to this if you aren't using a link? So we're going to go to cms.gov, which is the main portion of the website, Medicare, regulations and guidance. And I think this is where some people get confused because I think manual, it should be under coverage, but the coverage is only one portion of the manuals. The manuals do talk about, again, billing and a variety of other things, which is why it's not under coverage, because a lot of these other things fit within the manuals. So regulations and guidance, then we're going to go manuals and internet only manuals. One thing I do want to caution people when you're talking about Medicare secondary payer information, don't forget about reading some of the other sections like the Medicare Benefit Policy Manual. Is it a benefit in the first place? If you don't know that, start with is it a benefit? Scroll down to chapter 16, the general exclusions. This is going to tell you, hey, this isn't even a Medicare benefit, which means the conditional payment, Medicare secondary payer, none of it applies because it's not a Medicare benefit. Just a great way to check that out. Otherwise, the big one for Medicare secondary payer is going to be the 100-05 Medicare secondary payer manual. Well, that makes sense. That will also then contain the information on conditional payments. Okay. Contain the information on conditional payments. And I just scrolled down so you can see all the different chapters kind of outlined. I was asked about this crosswalk and what that means. The crosswalk is because we used to have what we called paper manuals. And if you're not familiar with the paper manuals, I will tell you there is a lot of information that used to be contained but duplicative in there as well. And the crosswalk just crosswalks what was in a paper manual to what is now in the internet only manual. These paper manuals have not been in use for a very long time, so they're not exactly accurate because they have changed the internet only manuals, the ones that are on the internet. Those are the more conditional ones, okay? But if you go to the general overview information, which is what we're looking at here, you can read through all the provisions. And the reason that I like to tell people to do this is start here with workers' compensation, no fault liability. And then conditional primary Medicare benefits. This is what we're looking at. Okay. Now there is some special caveats for group health insurance. I will tell you they are not allowed very often. And so if you are trying to use that for something that is an employer-based plan, yes, read those caveats because it's not frequent that conditional payments are allowed. Not frequent at all. But I wanted to show you where to find that information should you need it, okay? So if you go to conditional payments, you can read all about the basics of it. You know, here's the codified regulations. Here's some other stuff you might want to know. And again, it'll give you different publications and chapters and sections and things to read. If you see something in red, it was the most recent revision. Now, I will tell you, even though this revision occurred in 2023, this is still the most recent to this particular manual. That's why it's still in red. But you can read through the different sections. It will refer you back and forth. It will refer you to laws. It's going to give you all kinds of different references. So I think this is a great starting point. And I'm just kind of scrolling through it. You can see all the different information that is here. Okay. That's one piece of information I really do recommend when you're getting into conditional payments if you want any of this stuff. If you just kind of want to keep scrolling through, you can always just look down the different sections up above and see a bunch of different pieces that you want. But I just thought I would show this to you. Another interesting piece for people is the 100-04. So we've looked at benefits, we've looked at Medicare Secondary Payer, but don't forget to look at the claims processing manual. This is the one that talks about what needs to be done from general billing requirements through all the different types. And then it also goes even so far as to give you guidance on billing electronic claims and also which is chapter 24, sorry, and billing the 1450 or UB04 claims, the 1500 claim forms. So lots of information here if you need it just on general billing, okay? We were asked a question in particular about when can you bill a 1500 claim form. So I'm going to assume you're talking about the exceptions. So Medicare does have a rule, and Medicare Conditional Payments is not exempt from this. You do have to file these claims electronically. However, it goes on to say that there are exceptions within that, and you can go ahead and look at those exceptions. They're actually going to be in the electronic one, electronic chapter, which is 24, and it'll talk about exceptions to electronic filing. I'm not going to scroll through this, but if I type Control F, I'll open it, and then I can just type exceptions. Okay. Mandatory electronic submissions. Oh, wait, what's my exceptions rule? And here they are. So again, conditional payment, Medicare Secondary Payer is not listed in this, but I do want you to know where to find the exceptions should you need them, but it's not going to be part of this daily operating instruction. All right. Let's jump back for a second here. Another area that people like a lot when we talk about Medicare Secondary Payer, and it does have a section in particular on conditional payment, is the MSP booklet by CMS. Now, the MSP booklet is a training and education tool, training and education, and then you want to open the Medicare Learning Network. It's where it's actually located at, and it is a resource or a training, so we'll keep going there. Once we get to this page, we're going to go to publications and multimedia. I don't like to search the term Medicare. I think there's too many hits for it, but I don't mind searching secondary. And you can see it then brings up just a couple of things. This is the booklet that we're talking about. Don't ignore the fact sheet, but it doesn't really have a lot on conditional payment. It just says bill, don't not bill. But Medicare Secondary Payer booklet, which is slide 16, what's great about this booklet is that you can go ahead and download it and then read through all the different pieces of information. And here's where you're going to get some basic information on conditional payments. So here's when it applies to it, things you need to know. Just really the goal is to, again, avoid that financial hardship while you're waiting. So it'll just kind of walk you through some of the real basics of it, giving you even some of the basics of what happens with the common working file. If you're not familiar, I guess, with what the common working file is, it's simply the communication hub. It's who the BCRC puts information to. So they put it in the coordination and benefits system, which then gets communicated to the common working file. We as a claims processor enter it into one of two systems, and that gets communicated to the common working file. Social Security and the Railroad Retirement Board put eligibility information into their systems, but then that gets communicated to the common working file. Medicare Advantage Plan, are you guys getting the hint here? Everything goes to the common working file, and it's a central kind of repository that everything talks to and makes decisions based on that. So again, the common working file through the benefit coordination system, when it shows this stuff, this is what we're looking for, okay? The biggest question that we get regarding this, and especially regarding conditional payments, is who's responsible for updating the common working file? And the answer to that is ultimately it's the patient's record, and the patient is responsible for that. We, your Medicare administrative contractor, do not update this. It's not something you can call us and say, hey, can you update this? Because our answer will be no. On the other hand, could a provider do this? And the answer is yes, with very limited circumstances, and they must have information from the primary insurance on letterhead or identifiable information. Okay, well, once they have that information, what do they do with that information? And the answer is contact the Benefit Coordination and Recovery Center, or BCRC. So how do you know where that information's at? We're going to go back to the CMS website, go back to the top, back to the term Medicare. Now we're just going to kind of scroll through, what do we think with the Coordination of Benefits and Recovery Center? Oh, how about the Coordination of Benefits section? That makes sense. Now, I like to just go straight to the overview rather than trying to go to any of these different things. Just go to the overview. The reason I like the overview is that it then opens the left navigation. And if I scroll down, context is available right there. I don't have to scroll around and try to find it. It will go through all the different pieces of information. But again, remember that in order for a provider to do this type of an update with the BCRC, the catch is the provider has to have the information on letterhead or information from the primary insurance. They should have the effective and expiration dates of that. No, you do not need that to file a claim. You could file the claim stating, hey, the primary insurance was billed. They denied it as not covered right now because the patient is not eligible for that insurance on that date of service. That would make Medicare process it. No conditional payment needed in that. No conditional payment needed in that place. That's a zero pay bill, but it's not a conditional payment situation. Okay. I was also asked if there's some information where Medicare Secondary Payer you can find more information in terms of training other than just from us, and the answer is absolutely. The CMS website on the Coordination of Benefits page, if you go to the Medicare Secondary Payer page right here, you can read all about secondary payer, common situations, but we're gonna scroll down to the bottom. Sorry, look away if you don't like my fast scroll. Here is the CMS PDF on-demand training course, and you can open PDF by PDF and read through the different pieces of information. Okay, so there's just a variety of pieces of information you'll need to be able to see, should you want to be able to see any of those. So let's just go through the MSP overview real quick. Okay, you can download the overview. And you can see it's built in a slide deck with slide notes, and as you look through, it will help you understand. Remember, if you're looking for coordination of benefits or anything that you're looking for within here, you can hit Control F and just search this as a document, just like you would any other PDF. All right. Jump back to our presentation and see exactly what slide we're on, because I know I've covered a lot of information. Actually, MSP. So the WPS website, what does our website offer you? A couple of people asked about this section right here, which is the secure section, and does it have information on conditional payments within it? And the answer is no. But it does kind of help you understand when a claim came to Medicare and what's going on with it. For instance, it was applied to deductible or not. So we'll talk a little bit about that, and we'll talk about some of the claims processing sections. Okay. So the first thing I wanted to make you aware of when it comes to our website, oops, sorry, this is where we were earlier. Let's go back to the beginning. It's wpsjha.com. When you go to the training center, right up here on the top, and you scroll down, the last item on the right column in the body is specialty services and training. And when you scroll down within there, you'll see a list of items. You'll come to Medicare Secondary Payer resources. This is a great resource to move you around and to read different items and information you may need to know or you may want to know. So a lot of good information within there. I will tell you some of this is what we've already talked about, but don't forget that we also have WPS information as well. Okay? So it kind of helps you through a variety of different resources just depending on what you're looking at. I was asked specifically about the WPS resource Medicare Secondary Payer calculator and does it work for conditional payments? And the answer is it will tell you what Medicare will pay for it should they have been primary or what they would pay had a coordination occurred. However, it doesn't work for conditional payments because that's where the primary didn't pay, remember? That's why you had to wait 120 days because it didn't pay. So it doesn't work necessarily for what you're looking for based on the question that I received. Okay. What else should you be aware of? Look, if you want to know if the claim processed correctly, you can again look at the MSP calculator. However, if you want to verify information, this isn't a place really to do that. What you want to do is come into the portal user manual here so that you can learn about using the SecureNet Access portal, which is again just simply this login section. Inside there, most of the MSP information on eligibility, types of things like that will be under the eligibility check. Now, why do I say that's where most of the information is? Well, obviously how we processed a claim and what we did with that individual unique claim to get you a remit notice would be under claim status. Okay, so eligibility check. If you're looking for information within the eligibility check, yes, it'll explain, okay, enter your eligibility information, scroll down, scroll down. First place to stop, you'll see supplemental insurance and eligibility. Supplemental insurance is not what we're talking about. That follows Medicare. Conditional payment is based in primary. So then if you scroll down, you're going to go eligibility and you're going to get a variety of links. Anything that is gray and white, no information available. Blue and white, information available. If you're colorblind, it is very hard to tell the difference, but please note that all of the blue will be first, followed by all of the gray. So you can see we do have a tab just for MSP. We're going to scroll down just so you guys can take a look at that because it does have your insurance type on it, which is key for conditional payment because remember, insurance all primaries are not the same. So therefore, conditional payments are not offered for all types of primary insurance. Okay. So you can read through all the different pieces of information. It'll tell you your group ID, policy number, patient relationship codes, MSP source code. This is what we're talking about. So you want to make sure you're aware of that as well when you look for whether or not you can bill a conditional payment. There is information on direct data entry, which is used by people that bill on a UB04 or 837I, and it's the HIQA Health Insurance Query Access. It's the same basic information, just given to you in a different way. So you can take a look at that. Again, it's called direct data entry or DDE. The next slide will actually give you just a list of some common articles, and you can read through any of those common articles. Let me jump back and help you out a little bit here. So the Benefit Coordination and Recovery Center, we have this on our website. In case you're on our website and you're looking for how to contact them or you need more information on what they do, etc., that's what we gave this for. The MSP questionnaire is a questionnaire, a series of questions that is required. Okay, it is required. Now, please remember that with that series of questions, it is asked in chronology, or it is asked in order, and there are supplemental questions. So if you say yes, then ask this, this, and this. If you say no, skip these and go here, type of questions. So it's just a nice resource to get you to those questions because you do have to determine if there's primary insurance before Medicare. Billing procedures and the fact sheet, again, it just depends on how you bill, which one is applicable to you, but they both do contain billing procedures. This is for UB04 and 837I. This is for 1500 and 837P, so make sure you're selecting the right one. I did have a question come in and they told me they were a 1500 or 837P biller, but they were trying to follow the Part A Medicare secondary billing procedures. And my response to you is, first, you don't probably get it, because if you look at some of these different procedures, there's going to be items mentioned you won't have any idea about. So here's the MSP codes, which are great, but you don't have all these different codes. Like, you don't have occurrence codes, and you don't have all of these different codes that are going to be on your claim. So this probably isn't your best option. If you do need coding advice, this is where we definitely do recommend coming and looking for all of those types of things. Here's your conditional payment information if you are a Part A biller on the UB 04837 I. So a Part A biller is defined by CMS line of business. Make sure you have this information. Now again, if we go back to the slide deck, the Part B billers, who are the 1500 837P billers by CMS line of business, it will walk you through determining and all of the different pieces you need. Your claims do look quite different because they aren't even the same claim form. So hopefully this all makes sense to you and that you have what you need within this. All right. So I've given you a lot of resources, a lot of basic information. Let me do a quick summary before we move into these questions. First, a conditional payment is when there is a workers' comp, liability, no fault insurance that has not paid before Medicare. You do have to wait 120 days from the date of service. A lot of people say, okay, can I just go 120 days from the day I filed the claim that I don't have to worry about it? And the answer is yes. The conditions that you're asking for, what you're looking for, is to help give you revenue while you wait for the final decision from the primary payer. So while you wait for them to decide whatever they're going to decide. Will you always have to pay that back once the decision is made? And the answer is no, not even a little bit. Okay, so I want to make that clear, because sometimes the primary payer comes through and let's say it's a lawsuit and the lawsuit then says order it. Now the legal representative is working with that. And the legal representative is of the patient or is of the insurance or whoever is ordered to work through that process. All right. The first question we had is, do conditional payments recovered from liability or no fault count against the number of inpatient care days available? The key thing within this question is that they are recovered. In other words, the money was taken back, whether it's from the provider or from the primary insurance. Because the money was taken back, the claim is actually removed. So no, they do not count as covered days. They do not count as inpatient covered days. For those of you that don't understand that answer, Medicare has a set limit for inpatient days that they will cover. Inpatient hospitalization has one set limit, and skilled nursing facility has a separate set limit. And once you reach that, you don't get anything more until you have a 60-day lapse in inpatient care. So they want to make sure that, hey, this gets removed so that you still get your payments and all of those types of things. All right, next question, and we did look at this one a little bit earlier, is why doesn't conditional payments apply to group health plans? The answer to that is actually within that IOM that I showed you, the chapter 1 and the sections 270.1 and 270.2. Remember I called out and I'm like, hey, make sure that you have these two situations and you read these two situations because they're very limiting. So you again filed a proper group health plan claim and the plan denied the claim in whole or in part. Okay, now we can look at it. Also, the beneficiary has a mental or physical or mental inability and they cannot help you file a proper claim. Document that. That's important because if that happens, we can give you a conditional payment while you try to figure things out. But without that documentation as to what the physical or mental incapacity is, we're kind of stuck. So we want to make sure that you have that documented properly within your documentation. And there isn't a set rule to say it has to be a patient care report or anything like that. It just says have it within your documentation. The next question is, does a workers' compensation set aside offer conditional payment? The answer to this is no. A set aside has already been determined that there's a set of money to pay for medical services. It's the whole point of the set aside. Someone is liable, whatever the situation is under workers' comp. Here's what they're liable for, here's when the liability applies, and here's the extra money for the future. Because it's extra money set aside for the future, when the future is used, such as your service, there is no conditional payment. They should be paying you within 120 days. So if it is a workers' compensation set aside amount, no, a conditional payment will not be applied. And that is actually going to be back in that general MSP information. And I gave you this section to answer that. When is an MSP needed? Well, here's the thing. It's always needed. If there is a primary insurance, you do have to bill them before billing Medicare. It's always needed. Okay. But if there's not, then you do bill Medicare directly. The catch there is, how do you determine that? And the answer is, it is the provider's responsibility, the person billing Medicare who's ultimately going to get money. It's their responsibility for every claim to check. Now, does CMS say, hey, it's an individual claim? The answer is no, not always. If you're billing on a UB04 837I and you're billing for any start of institutional inpatient care, then yes, you need to check. You need to ask the questions, right? If, on the other hand, it is considered care that you're going to do more than once, a great example, maybe dialysis, hematology, oncology, like cancer treatments, things like physical therapy, occupational therapy, you're expected to do them over a course of time. Then you have to ask at the start of care and every 90 days they're following. Now, in a 1500 claim form or 837P electronic transaction, it's even more interesting because how CMS words that is, you have to ask frequently enough to make sure that you have the primary coverage in place. Well, what does frequently enough mean? WPS offers advice, but there is no final determination. It is the provider's responsibility, the provider billing on that 1500 claim form or 837P. Our advice to you is to follow the Part A billing, Part A line of business, 90 days. That's just our advice. If you need more information on those types of things, I will recommend checking out the playlist, which is the Medicare Secondary Payer playlist in YouTube. It's got a bunch of courses on it that we've done previously, not just specifically related to conditional payments, but related to Medicare Secondary Payer overall, group health plans, non-group health plans. So lots of different pieces of information. And let me show you how to find that. When you're on YouTube, you want to go to the WPS Government Services Medicare YouTube channel. However you want to get here. Then just go to the playlist. Again, go to your playlist, do a quick search. Again, I try to search for the word secondary more than Medicare. It's just because Medicare is used so frequently. By doing that, it's going to say, okay, do you want this video? Do you want the public playlist? Oh, well, I want this playlist. I want to see what all videos WPS has. When you open it, you'll be able to see all the videos listed there. So it just depends on what you're doing, and you know, it'll help walk you through all those different sections. I also would like to remind you that we are offering MSP courses. We do about one a month, and our goal with that is just to get you the general MSP courses live where you can ask questions as well. So a couple of things to answer that question. Again, if you need those MSP questions, which is sometimes referred to as the questionnaire, you can take a look at that, but that's going to be in the IOM as well. How to properly close an old MSP that should have already been termed out. Okay, so first, please remember that with conditional payments, because they're related to liability, no fault and workers' compensation insurance, these can be active for years. Okay, the claim, the date could all be years later and still falling into it. So it may not need to be closed. On the other hand, you may need to bill them and get a, hey, this isn't part of this particular claim. Even though the diagnosis is in the system and that diagnosis says it is, if the primary insurance deems it not part of it, we'll take that and we'll process as primary, but you do have to make sure we get that information. So to really answer this question though, you do need to contact the Benefit Coordination and Recovery Center. As a provider, your information must come on the form of a letterhead from the primary insurance that has the expiration date, the used up date, when there is no funds left date, whatever you want to call it. But it has to have a final date for when they will consider charges. And that should be done by data service. Once that gets to them, they will take the time to update it, and then it will be updated within the common working file. Keep in mind, if somebody else submits a different claim in the meantime or something else in the meantime, it can affect that update. We've seen this happen a lot, where all of a sudden you send something and say, oh, nope, it should be closed on this date. Here's the information. Another provider sends something in and they say, there is this case, but yours was Blue Cross Blue Shield. They put BCBS. Like, yes, that's a common acronym for it, but the system's not smart enough to know that that acronym actually represents the same thing. So guess what happens? Another one is opened, and then we have to go through the process again. So that was another portion of this question, which I didn't put fully in there, but hopefully I got it all. If not, throw that back into the chat. We'll get you some more information on that. This is actually a very good question, and it's about what documentation will WPS accept for conditional payments. The reason that I left this as the last slide in the last set of questions is I want you to keep this in your head. We do not require documentation for conditional payments. What could happen is you would need to show somehow in some way that the 120-day period has been met. That could be, hey, we filed the claim on this date, no response. It's over 120 days later, so we filed for conditional payment. Great. It can simply be a statement because you may not have anything from the primary insurance. We just need to know when that first claim was filed or when that was opened. It could even be something from another provider, or I'm sorry, another insurance stating, hey, this claim was opened or this case was opened on this day. We still haven't finalized it, therefore you're not getting money. Could that 120 days have already passed? Sure, it could. The promptly paid period could be way over and done by the time you even go to file your claim. And when they come back and say, yep, it was open, however, we're not paying you because it's still in dispute. Okay, well, when was the case opened? Sometimes they're going to give you that. If it's over 120 days ago, that will meet the exception rule. Remember that rule that said you have to know when, and here's what happens if you don't know when, that we talked about earlier. Hopefully that helps you. All right, I do have one question that was given to me, but it was given to me after I built the slide. So I'll go over that question, then we'll open for live questions. So if there isn't an open MSP case for auto coverage, can we bill Medicare without waiting the 120 days? My answer to that is this is a conditional situation on whether or not you can bill. If the insurance is on file with a close date, yes, go ahead and bill it, right? You don't need to wait 120 days. We know that insurance is already expired for your date of service. If the date of service falls before the expiration date, don't bill that. Go through the process of getting the claim, whether they deny it, whatever they do with it. We want to make sure we have that available, okay? If the insurance isn't even on file, then before you bill that claim to us, yes, you need to make sure it gets added to the file for whatever reason, because if it does not get added, what's going to happen is we're going to pay you. Someone else may add it later, and what's going to happen to your money? We're going to ask for it back. So we want to make sure it's on file. Okay. That brings me to the last of the pre-submitted questions. So now Leanne is going to go ahead and ask me any questions that are in the chat. So Leanne, do we have anything?
Tom, we do have a few questions in the chat. The first one is asking on work comp, liability, and no fault, who is actually responsible to close the CWF file, the patient or the carrier?
It is the patient. The patient is ultimately responsible. Now, I say that, and you guys will hear me give a little giggle, or you'll hear me kind of give a sigh, because we all know that in the real world, some patients just won't do it. Like, it's not going to happen. That's where the information was added from CMS that says, hey, if you can get something from the insurance on their letterhead saying, hey, the benefits are expired, or they were used up, they're done, there's no more benefits, we can close that with information that will allow your claim to process. Otherwise, you are required on a claim by claim basis to file it to the insurance to get a denial, and then you file it for primary coverage based on that individual denial, but that's only good for that claim. So ultimately, it is the patient's responsibility.
All right, next question. If primary has applied a portion towards deductible and copay, but no payment was made, why would WPS tell me in order for a claim to pass the DDE, I have to put it in remarks put in the remarks conditional payment?
I'm not sure what's going on with that, and I would recommend contacting customer service with that one. I would recommend putting that in writing, giving them the number, the claim number, all of that information, and going through customer service in writing. Now, if you're close to the time frame, you can contact customer service. I don't know. Again, I can't see the edits. I can't see the audits. I can't speculate through that without having more information in front of me. So it makes it very hard to do that one. Again, put it in writing, send it to customer service. They'll take a look at it that way. If you do need an immediate answer, you can always try to call, but I have a feeling that would have to be moved up. That they'll have to look more into that one. I don't know. No, I can't look into it, and no, I cannot take that claim number from you. That is a customer service function as defined by CMS. Sorry, Leanne, go ahead.
No, you're just fine. And that was actually the last question we had in the chat.
Okay, so if you have more questions, put those in the chat. I just want to remind everyone that, again, a conditional payment is your option as the provider. You are not required to take a conditional payment unless there is a law or something governing your area. But again, that's a specific state law or specific area law. It's not something that we're involved with. It is a Medicare rule that you don't have to take it. It's your option to choose to take it. All right, let's go on. So you will be getting a follow-up email. Now, again, if you did sign in with a phone number and you didn't give me a email address, I won't have any place to send it. So what you want to do is send us an email, and we'll talk about that in just a few moments. But for those of you that did sign in and I do have your email, you will be receiving a follow-up. And it is just a, hey, here's some information. Now, in that follow-up email, you will have a certificate of achievement, which will give you contact hours. And it's one contact hour for this entire course. Again, 1 hour worth of lecture time equals 1 contact hours. You then have to contact your governing body for CEUs, whoever that happens to be, and see if they will accept it. But keep the email because that's your proof that you attended. Right? Keep your email. That's the proof that you attended. If, on the other hand, you dialed in and you get this email that says, thanks, but you didn't attend, here's some information you want, respond back to that or send us an email. And the email is right here on this slide. It's wps.gha.education@wpsic.com. The reason that you want to send us that email is because our system can't generate something not knowing that. So all of a sudden you'll get this email saying you didn't attend, but you did attend via phone. What you'll want to do is in there, add the information saying, I did attend this only via phone, and here's the phone number. Can I get a paper certificate? What we will actually do is send you a certificate in that manner. Everyone else already has theirs, but because you did dial in and you did listen, I can't give it any other way. But if you don't include your full phone number with an area code, you also will not be eligible for a certificate, okay? So please make sure you do that correctly. And I always recommend MSP conditional payments, probably your best bet right in the subject line. Tell us right up front what you're looking for. You could just say conditional payment. I'm good with that. Help us understand what you're doing there, okay? A little bit more about the survey. I will recommend that everyone takes the survey. We'll let you know that one, in the follow-up email, there'll be right at the top, it'll say, give us your feedback. That's about the survey. You can use that link if you would like and take the survey. I'm going to have Leanne place a survey link in the chat. The survey link is just that. You can select it right now, take the survey, give us whatever feedback you want. Also, we're going to give you an opportunity when we end the webinar, and it's going to look like that bottom box. It'll say external site on it. And it's going to give you the opportunity to select continue and be taken directly to the survey. So you don't have to do anything. You can wait until we close the webinar. You'll get to the survey. Want the survey so much that in the encore presentation, I'm going to give it to you the opportunity to take the survey again, but that's going to be the top picture that says online survey. So again, lots of ways to get to the survey, lots of ways to take it. What are we looking for? What does WPS do well? What did I do well with this education? What did I need to work on? What does WPS need to work on? What types of education would you like to see in the future? It doesn't have to be anything related to Medicare Secondary Payer. We're not looking for that. It doesn't have to be related to conditional payments. Not looking for that. Just, hey, what would help you? Please don't be generic. One of my favorite ones is that I got asked for ambulance education, and I was like, lots going on with ambulance. What do you want me to do? We also got asked for evaluation and management education. Okay, well, do you want inpatient? Do you want SNF? Do you want outpatient office? What are we looking for? So just kind of help us along with that one if you do give us feedback on that. Not that I'm discouraging you. I think it would be great if we could get that. A lot of times you'll hear me say, hey, give me the good, the bad, and the ugly. Well, my good is, hey, what did I do well? What did WPS do well? Bad, again, what could I improve on, or what can we improve on? And my ugly is simply, did you like my PowerPoint? Did you like the website resources? Did you like things like that? I will tell you that if you put that you don't like CMS's website, there's nothing we can do to help you with that one. But you can put it in there if you want. A couple of things that we want you to be aware of is that we do listen to these surveys and we do read through the comments. So we have made changes based on the surveys, and here are just a few quick highlighted ones. One, we added chapters to our YouTube videos. You were asking for bite-sized chunks of information in YouTube. So by adding chapters, you can take an hour-long video and break it up into smaller chunks or sections and locate information. We'll do that for this encore. We also then added training indicators. So you wanted to know, how can I easily find out if this training applies to me? And that's what we use the indicators for. So those are types of things that came in from this survey that we actually did follow through on. One last opportunity. Any more questions in the chat, Leanne, before I go on?
Tom, we do not have any additional questions in the chat.
All right, well, that brings me to the end. I want to thank everybody for attending. I hope you guys got something out of it, and I did get your questions answered. Hopefully y'all have a great day. We encourage you to attend more, and we also encourage you to give us feedback on that survey. Give us as much as you want. On behalf of myself and Leanne, I'll provide our Outreach Education. Thanks for participating. You may now disconnect.